According to the World Health Organization, lower back pain is among the top 10 medical conditions that decrease the quality of life across the global population. So don't let your chronic neck or back pain ruin the quality of your life. Our back and neck pain expert, Dr. Christopher Miller, is here to discuss pain and solutions that may help you feel better. And he's invited one of his patients, Pamela, here to share her story and her progress with us. Welcome to 8 West. So, Dr. Miller, let's talk about this. We talk about a lot of different reasons why maybe people have back and neck pain. What are some of the most common things that people come to see you for?
Well, most of the patients that come to us have been either had a traumatic accident that really made things worse very quickly, or it's just been accumulation of stress and neglect over their lifetime where their spine starts to rot and decay, and they may get things like degenerative disc disease, or even worse, maybe a bulging or a herniated disc where they actually push right against one of the nerve roots. That can lead to things like sciatica pain, which is shooting pain down the leg. Sometimes similar issues can happen in the neck and go into the arm or hand, even start leading to things like carpal tunnel syndrome. But, you know, when you talk about neck or back pain, you think, well, that's too bad, but it's really more than that for many patients. It's affecting, like I said, their quality of life. They're not able to live normally. They start their day with pain, they end their day with pain. Everything they try to do revolves around that. It's very disruptive to their lifestyle and living the life they want to live.
You know, you talk about that, and you talk about sort of the progression that happens if people don't get the proper kind of treatment, and we really see that illustrated here on these discs.
Sure, and these models show the different stages of spinal decay or degeneration, and you know, this is what healthy looks like, Terry. This is the point of no return, where it's so bad the bones actually fuse themselves together, and then you would have a permanently pinched nerve. But a lot of patients we see wait to get into this range, where the discs are very thin. As I said, sometimes those discs bulge or herniate into the nerves, and that can be more than just neck or back pain. That could shoot in the arm or leg, be shooting electrical pain, numbness and tingling. Sometimes they start getting weakness in the extremities where they're dropping utensils, or, you know, they feel like their leg's going to give out, where they just can't stand any length
And they might
of
even
time.
fall, and then of course
Certainly.
that sets the stage for a whole new series of things. So what was Pamela's story? Why did she come to see you? How did you diagnose her?
Well, when Pam and I met, we, you know, consult with everybody in the beginning, and, you know, she can share her story, but she was just like these models here. As we looked at her images and did the examination, she had a lot of very severe degeneration in her lower back with degenerated discs, a bulging disc, and because that was her problem, we were able to effectively treat that with our spinal decompression program.
Yeah, why don't you tell us about the pain in your story? You lived with this for years and tried to get a lot of different failed treatments.
Yes, yes. It basically wrecked my life. I had no life. All I could do was stay in bed because the pain was so bad. I mean, I've gone through infusions, epidurals, trigger point shots, and every drug you can imagine. But it's like I couldn't cook a meal. I couldn't do laundry. It was hard showering because it's like it was just too painful. And it's like I did have the weakness on my side.
And then you ended up on morphine, which
that's the thing, that was the final point.
Led to you being bedridden, basically.
Correct.
So let's talk about why you finally reached out to Dr. Miller and sort of what the timeline has been.
My husband saw the show and then gave me the number and said you should call and try it. So we called, got an appointment right away, started the treatments. The following Monday, I think I went in to see him on Thursday, treated Monday, and within the first week, I noticed a big difference. It's like I could stand again, do walking, and then towards the second week, it's like I told my husband I'm in no pain, and I could cook a meal and stuff like that.
And so you stopped taking all of your pain medications?
Yep. I'm on no drugs right now, and I'm walking, I'm going to my granddaughter's cheerleading games and doing yard work, stuff that I haven't done in years.
So what was your reaction as you would wake up in the morning and wake up and not have the pain? Were you just amazed?
Yes, and I could even get a full night's sleep. Before, if I would roll over, I'd feel the pain. Trying to get up in the middle of the night, there's pain. You know, just walking down the hall to go to the bathroom, it was just miserable.
So, Dr. Miller, why was she able to get such relief so quickly, the DRX 9000 machine?
Well, Terry, I think the big reason why is that this machine effectively treats these conditions and helps to heal and repair them so that patients are feeling better because we're getting their discs healthier and their back healthier. We're not just trying to, mask the symptoms temporarily. And those treatments that Pam had done, as much as they wanted her to feel better, they just revolved around symptom relief. And when you have these conditions, you have to fix the problem if you want those kind of results. And that's what we do in our office. And, it's great because it's non-invasive. So there are no drugs, there's no shots, there's no surgery involved. It's a very gentle and specific stretch to that injured area of the spine through the aid of computers to help regenerate the discs again.
And so for people who may be sitting at home like Pamela, watching this and thinking about, the fact that maybe they have tried everything, you have a special offer for 8 West viewers.
We do. We really don't want them to struggle, Terry. So if they want to call our office today for $49, we'll do a consultation and an examination. And the first 3 callers will do a free MRI review so I can actually show them on their MRIs what's wrong and why they've been hurting so much.
And Pam, what would your message be to somebody sitting at home if they or a loved one is suffering intense pain like you were?
It is well worth it. I would recommend it to anybody. I already have. And I'm from Matawan, so it's worth the little over an hour drive, 4 days a week.
You got your life back.
Yes. And it's so nice.
Yeah, fantastic. Thanks so much. Thanks for joining us today on 8 West, and thanks, Dr.
Thank you.
Miller.
Thank you.